The SmartRelease Endoscopic Soft Tissue Release System is a single-portal endoscopic device that consists of a handpiece, endoscope, and blade assembly used to release compressive soft tissue, along with additional instruments to prepare and clear the surgical pathway. The assembled device has a small blade in the endoscopic viewing window that can be elevated and retracted to cut the aponeurosis of the gastrocnemius to lengthen the muscle and tendon. The endoscopic procedure with the SmartRelease system is easy to learn, simple to use. The procedure begins with the identification of the gastrocnemius muscle belly, medial aspect of the gastrocnemius aponeurosis, and the sural nerve. Once key landmarks have been identified and the incision has been made, a pathway for the device is then created by passing the dilators and elevators into the surgical site to create space and find the correct plan to access the aponeurosis. Once the blade assembly is ready to be inserted, the foot is dorsiflexed. Upon insertion, attention will direct to the endoscopic view as the device is introduced into the leg. In the endoscopic view, the aponeurosis is visualized along the surgical path and a clear view of the aponeurosis is confirmed. Aponeurosis is cut by pulling the trigger and deploying the cutting blade. A complete release is verified by inspecting the complete width of the cut. Increased mobility and range of motion can now be observed by moving the foot into dorsiflexion. Once complete, the device is removed and sutures are used to close the wound.